Will urodynamic testing disrupt my daily routine? Imagine a simple test that can help your doctor understand how your bladder and urinary system are functioning. That's what urodynamic testing is all about. It's a set of procedures used to see how well your bladder stores and releases urine. If you're experiencing issues like incontinence, frequent urination, difficulty emptying your bladder, or recurrent urinary infections, your healthcare provider might suggest this test to get to the root of the problem. For those concerned about bladder health or being evaluated for bladder cancer, urodynamic testing provides valuable information to guide diagnosis and treatment. The good news is that the actual testing usually takes between 30 and 45 minutes. Some more detailed tests might last up to an hour and 15 minutes. When you include time for preparation, changing clothes, and a brief interview with your doctor, plan to spend about 1 to 1.5 hours at the clinic. This means it's not an all-day event, and you can generally fit it into your schedule without too much trouble. Most people do not need to do special preparations before the test. You might be asked to arrive with a full bladder or to drink water beforehand to ensure your bladder is adequately filled for the procedure. You can usually continue taking your regular medications unless your doctor advises otherwise. After the test, you can typically go back to your normal activities, including driving yourself home. Some people might feel mild discomfort, a burning sensation, or notice they need to urinate more often for a few hours afterward. Drinking plenty of fluids after the test can help ease these symptoms and lower the chance of developing a urinary tract infection, which is a rare but possible side effect because of the catheter used during the procedure. In terms of daily life, urodynamic testing is minimally disruptive for most adults. You might want to plan for a short rest period if you experience some mild discomfort, but serious side effects are uncommon. If you have specific health concerns, such as a weakened immune system, a history of urinary infections, or bladder cancer, it's important to discuss these with your healthcare team beforehand. They can give you personalized advice and may prescribe antibiotics to prevent infection if needed. For those with bladder cancer, urodynamic testing can be useful before or after treatments to assess how well the bladder is functioning. This helps doctors plan surgeries or other therapies and monitor your bladder health over time. Remember, this testing is a safe, outpatient procedure that usually requires only a few hours of your day. Most people recover quickly and return to their usual routines the same day. If you experience any unusual symptoms after the test, such as persistent pain or fever, contact your healthcare provider promptly. Always follow their instructions and ask questions if you're unsure about how the test might affect your daily life. Consulting your medical team will ensure you get the best care tailored to your individual needs, especially if you are managing complex conditions like bladder cancer.